Hi, my name is Kaylee Lowe. This is my video pocket guide for NU 629, Advanced Health Promotion and Disease Prevention. This is my psychiatric mental health nurse practitioner pocket guide that I made for this assignment. I decided to go with a 3-ring binder. It's divided up into 6 sections with dividers, and then there's a reference page at the end. I ended up really liking the idea of this project because I do see myself in the future adding to this, editing it, and just kind of using this as a reference, especially as I start my career. I also want to have something at the end to hand out to patients, as well as like either education on medication or regarding therapy or local mental health support in the community nearby. So let's get started. So on the front, my pocket guide, and then I did a reference page, and I divided it up to levels of prevention, the depression scale, stress action handout, mental health in pregnancy, women's health, adult health labs, pediatric, mental health and geriatrics, and then references. So the first one, how do I get this closer? So this is levels of prevention. So just going through each one. And then as one of the levels of prevention, I included the patient health questionnaire, the PHQ-9 for the depression scale. So this could be a handout I could make copies of to give to them to fill out. And then this is for me to use, so depending on what they score and how to go about it. And then just some treatment considerations based on the score as well. And then I think it's a good idea to have like handouts ready or like worksheets. So this is one that we have at work, and it's a stress action plan. And then so it just says, make a list of everything that is stressing you out. Write down the most stressful things at the top of your list. In the next column, write down what you can do to deal with that stressor. And then in the last column, write down when you can get it done. So you kind of write what's stressing you out, what can I do about it, and when can I do it. So in the future, like I would just love to have like handouts for like different things, because some people like things online, and then at the end of the day, some people still like pen and paper. So this is for mental health during pregnancy, and this is just some common prenatal mental health disorders. So I went through depression, anxiety, OCD, PTSD, bipolar, and then psychosis. And then some screening tools to use. And this is during pregnancy. And then some medication considerations when it comes to the pregnant population. We know to avoid certain ones. So this is just for me in the future to remember like which ones are the go-to when it comes to someone who's pregnant. Maybe they need to be switched because they just found out they're pregnant, and kind of how to go about all that. So again, this is just like a little cheat sheet for me. Non-medication therapies, different things. And then patient education, and then postpartum mental health planning. Okay. Next, so for women's health, I did it on PMDD. And then I kind of wrote like a definition of it, DSM-5 criteria on diagnosing, assessment tips for me in the future, and then how to treat it, like what the first line meds are, and then second line meds. Then this is just some lifestyle interventions, and then patient educations. I was trying to think of things that maybe aren't so common, so when it comes up, I can deal with it. Adult health, so this is laboratory testing to rule out medical causes. So for this part, I kind of just did lab. So because I'm psych based, I feel like our labs are different. You know, like sometimes if they're vitamin B12 low, like that can be causing their depression. So there are certain labs that you want to take to rule out that it's not, you know, something that you can fix lab-wise before starting a medication. So I put like your thyroid function test, vitamin B12 and folate, CBC, blood glucose, your hemoglobin, some electrolytes, liver and renal function tests, and then just some other like inflammatory markers, hormonal ones, just because at the end of the day, and then sometimes, you know, it's a reminder that you need to take like a baseline before starting certain meds and follow up to see if it's affecting, especially when it comes to the kidney and the liver. So then for the pediatric portion, I feel like this is big in this population. So I did it on ADHD, and I did some assessment tools, DSM-5 criteria, some strategies, medications, how to follow up, comorbidities to screen for, and then just little tips and tricks for me at the end. Geriatrics. So for this population, I did common issues. So I did, is it delirium versus dementia? And then kind of how to go about that. You know, going easy on antipsychotics in this population, watching out for polypharmacy, what to monitor when they're older, and then just some quick tips for me once again when it comes to dealing with the geriatric population. My references, and then so I do plan on adding more. And then so I also found this one at work that I wanted to add. So this is a Smart Recovery, and this is like, we have like a bunch of different like little booklets, but so this one we make copies for people to do all the time because not everybody likes AA or NA. So Smart Recovery is like another option, and this kind of talks about it, and then it's also just a worksheet they can use throughout. But so I know a lot of people are big fans of Smart Recovery, so in the future I think it would be really nice just to kind of go through, or, you know, as we've already had some in-services at work when it comes to certain meds, and then they give us the pamphlets that we can give to patients. So I think it would be nice to kind of keep maybe even like a separate binder, do one of like a cheat sheet for me, one binder of just handouts on like patient education, and then one of like worksheets. So I definitely do want to keep going with this route and make it more pretty and just kind of go based on what I like, because I like everything colorful and coordinated. So I really enjoyed this assignment. All right, thank you.